How can we treat aortic stenosis? I am Dr. Vivek Kumar, Senior Consultant Interventional Cardiology at Indraprastha Apollo Hospitals, New Delhi. The treatment of aortic stenosis is replacement of the aortic valve. And how it can be done? It is mostly done through an open heart surgery where the native diseased aortic valve is removed and a new valve is implanted. But the unfortunate part is about 50% of these elderly patients are too sick to get a open heart surgery. So what is the option? The option for such patients is TAVR, that is transcatheter aortic valve replacement. You won't believe this procedure can be done under local anesthesia with a 6mm access from the groin arteries. We reach the aortic valve, we cross it with a guide wire, we dilate this valve to make a space for the new valve. We take a valve over a catheter, we deploy it, then we assess it through an echocardiography. If we find it functioning well, we are done, or if required, we can post-dilate it and we are done with the procedure. And this procedure leads to a successful treatment of aortic stenosis and the patient can be discharged after 48 hours.